Dear chairpersons, ladies and gentlemen, distinguished guests, it is a real pleasure for me to present in this very important event, and I would like first to congratulate the organizers of the 22nd Egyptian Thalassemia Association and the 18th Egyptian Society of Hematology and Research, who are organizing this highly educational event that, from the hematology and the presenters of this event, it is anticipated to be highly educational. It is therefore my privilege on behalf of Thalassaemia International Federation to present the global patient's view. And what I am about to present is really an effort that Thalassaemia International Federation has made in the last 2 years in the context of its close and official collaboration with World Health Organization on the compilation and assessment to the extent possible of the quality and extent of services provided to patients across the world. The Thalassaemia International Federation, I'm sure, is close to the heart of many of you in this event, close collaborators and friends for many years. It's an umbrella federation today embracing and safeguarding the rights of patients for equal access to quality health, social and other care in nearly 300 national thalassemia support groups in more than 60 countries of the world, divided into the 6 regions as these are defined by World Health Organization. Thalassaemia International Federation enjoys a close and official relation and partnership with a number of international and regional relevant bodies, including the World Health Organization, the United Nations ECOSOC, the European Commission, and the Council of Europe Conference of International NGOs since 1996. The Thalassaemia International Federation's work is based on 5 pillars of activities, including policy advocacy, education, networking, undertaking of relevant projects, and research work. Despite the fact that for a number of years now, we are aware that hemoglobin disorders occur widely across the world and are certainly not geographically confined, as the very original conception was about the occurrence of these disorders. And despite the fact that we are well aware for some time now that hemoglobin disorders have been and are a growing health problem in more than 70 countries, where 89%, nearly 90% of all the births occur globally, and that they constitute the third amongst the 5 common disorders that account for 25% of all the birth defects globally, we still evidence that there is a vast majority of patients with this disorder living in the low and middle income countries. In fact, these regions, which host more than 80% of the global patient population, receiving suboptimal or nearly suboptimal care, and where in these countries prevention programs are largely confined or completely absent, and where, as a result, the life expectancy of patients is still considerably and comparatively low. And this is what we are going to see in the next few slides that are taken from information compiled in our global TIF Thalassemia Review 2021, which I must underline that this is a dynamic work of TIF, and as new, reliable, and published information flows in and becomes available, will be added onto our information, and particularly the information concerning the country's profile and services with regards to hemoglobin disorders. Now, our patients have demonstrated their own ideas about who are the key players and to what extent these key players have contributed to the improvements in their health and social care. Almost 100% of the patients obtained through surveys between 2018 and 2020, with nearly 3,000 responders with the diagnosis of ETA thalassemia across the 6 regions of the world, found that governments and competent health authorities, healthcare professionals, science, research, academia, and patients and families themselves are the 4 key players that can contribute to improvements in their health, social, and other care. Although their opinion of the extent to which each player has contributed to date to these improvements demonstrates that they patients believe that the patients and families themselves, as well as science, research, and academia, have played a more important role than the government and competent authorities themselves. The patient journey is a difficult and complex. The patient journey of thalassemia is an example of hemoglobin disorders. We are all aware in this prestigious audience that indeed is complex and difficult journey, starting from an early and accurate diagnosis, reference to expert treating physicians, trained centers, reference to well-structured and coordinated multidisciplinary care for such a complex multi-organ disorder, for certainly provision of appropriate and disease-specific as well as chronic disease-specific social care, research and innovation to contribute to continued improvements. Very importantly, patient engagement and patient perspective in all this, as well as patient education, is extremely important. And of course, the lifelong education of healthcare professionals. All these elements, however, can contribute to improvements only if they are in the context of a healthcare system that is based on universal health coverage and includes disease-specific, nationally coordinated control programs, including prevention, management, as well as national registries. These are the elements which are provided by countries that have shown success in survival and quality of life of patients. Hence, the 2 most important components for successful control at the national level include prevention and clinical management, with a number of different elements in each of these key components that we are not going to focus at this point in time, as we need to refer to the information gathered in the global review. So with regards to prevention, what is happening to prevention across the world? Effectiveness by TIF is defined in the context of a grading exercise that we have developed. And it's a competency of a country to cover the needs of more than 70% of the country's population in the context of prevention of hemoglobin disorders. And there has been an attempt by TIF to gather information across country members of TIF, more than 48 countries across the world in the 6 regions, that is West Pacific, Southeast Asia region, Middle East, Europe, America, and Northern Africa. And we have attempted to evaluate and assess whether there is a national program in place, and within this national program, whether elements such as public awareness, education of the community at large, screening, prenatal diagnosis services, surveillance, and genetic counseling services are available and coordinated within a national program. According to whether these elements were existing alone, regionally, locally, or within the national program covering more than 70% of the population, a certain scoring was given. And as we see in the middle of this slide, the scoring category of countries scoring more than 20 units, countries were those countries that demonstrated reduction in the annual number of affected births, more than 70%. Countries scored B were the countries that we feel demonstrate a program of good effectiveness with considerable but not sufficient national coordination, and support is further needed. Now, countries with scoring less than 15 units, that is C and D countries, describe the countries which demonstrate absence or largely absence programs, and with considering that more and considerable efforts are needed to establish effective prevention. With regards to health and social care services, blood transfusion therapy constitutes the first cornerstone of management, as we all know. And for effective transfusion therapy in thalassemia, of course, adequacy and safety are needed. And safety involves, of course, the appropriate screening, processing, leukodepletion, appropriate storage, fresh blood, and appropriate distribution of the blood. So the global review 2020 on thalassemia included the information compiled through 3 years reporting of national thalassemia associations, the patient's perspective. And it is very well demonstrated that there are many weaknesses across the world globally in the postponement of blood, postponement of filtering. Patients are not aware whether there is a central national blood transfusion service. A small but yet significant percentage receives still whole blood on occasions, and there is a big percentage of patients that are not aware of the existence of a hemovigilance system, or a system where they can report adverse reactions. A big percentage of patients who are aware of their pre-transfusion hemoglobin are reporting hemoglobins lower than 9, a big percentage of more than 70%, 68% of whom report pre-transfusion hemoglobins of between 7 to 8, and a lesser but still significant for us percentage demonstrate or report a percentage, a pre-transfusion hemoglobin of less than 7. So we can therefore demonstrate that blood transfusion services require strengthening, require centrally structured transfusion services with very much focus on safety and adequacy, because adequacy for thalassemia patients is completely different from other kind of anemias that require periodically blood transfusion. And very importantly, we need to strengthen the hemovigilance programs and other elements of appropriate processing. The second cornerstone of management of health and social care is, of course, the iron load monitoring and treatment. So TIF gathered all the information published in the literature, but also from official reports at country level that TIF has been working on for many years now, as well as reports from healthcare professionals, as well as patients' perspective through the responses of questionnaires gathered together. It is well demonstrated from this information that exists today that although availability of iron load monitoring tools, including MRI, ferritin testing, LIC testing for the heart, for the liver, and MRI testing for the heart, the frequency of ferritin testing, the frequency of MRI testing, whether these are offered as free of charge services or as out-of-pocket services, taking all these elements together, we have tried to score the availability. And although in many countries it is demonstrated that there is the availability and the potential to measure the iron load, there are still weaknesses in the frequency, in the out-of-pocket expenses for achieving, and in the quality standards placed for these tools in measuring iron load monitoring. And the more importantly is the effectiveness of iron chelation, because that was the second element of iron load as a chapter. The monitoring, in having effective monitoring, and then in having effective chelation. Effective chelation was also information gathered on the existence of all three available, all three authorized chelators, whether these were available, all three of them, whether they were available as free of charge or as reimbursement policies. And we have tried to investigate all these parameters across our country members. And what was demonstrated that in more than 60% of the countries, despite the stated availability, the effectiveness based on the mean age distribution, on the level of ferritins, T2 star for cardiac, LIC for the liver, on the percentage of patients with cardiac and liver complications. We've tried to make a gross scoring countries between A to D with regards to their effectiveness, to their potential effectiveness. As I said, the absence of published literature and the absence of registries and data on this made our work very difficult and challenging, but it was our commitment and our determination to give a focus on the quality and extent of these services with the purpose of spreading awareness to governments and competent authorities, but also giving a tool and a compass to the Thalassaemia International Federation to continue and strengthen in a more tailored way its work. So on this scoring methodology for the effectiveness of iron overload control, we can see what the parameters that were included, including the mean age of the patients, the mean serum ferritin, the liver iron content, the T2 star, the LIC, and the percentage of the patients with cardiac and liver complications. So this is an overall map showing the countries that were studied. And the two columns, three columns, the first column shows the Human Development Index of the country, which is an element very much related in most of the cases to the quality of care provided in a country. And we can see from the information that we had until the date of publishing of this global review that in the column of effectiveness and availability, we can see that the availability may score A to B, which demonstrates the potential availability of iron load monitoring tools. But we see on the effectiveness column that there are many C's and D's and many red spots. The red spots demonstrate the absence of available information. And this is very important to obtain in order to give the right compass to the competent authorities. So the weaknesses in assessing the effectiveness of iron load is mainly the absence of data, but where there was data, in more than 60 countries, the effectiveness is highly jeopardized. The third component of health and social care is, of course, the multidisciplinary care, which again, from information across the world in having multidisciplinary care, including the major medical disciplines like cardiology, endocrinology, hepatology, we can demonstrate with our data that access to multidisciplinary care is indeed very confined to less than 2% of the patient population. In nearly 100%, 98.5%, there is no organized expert medical disciplinary care. Very rarely patients, in nearly 80% of the patients, very rarely receive medical multidisciplinary care, and reference centers exist in less than 4% of the countries. The social benefits, there was huge information and huge research made in order to gather information. On the right side, you can see a very complex map, which is an overview of the benefits provided to people with hemoglobin disorders in 38 countries across the 6 World Health Organization regions. What this map shows, and I would invite you to read the global review, which is online on TIF's website, shows that there is really a very confined disease-specific and state-provided social benefits to patients with hemoglobin disorders. There is a need for benefits with regards to employment, social support, retirement, traveling, and a number of other benefits that very few countries indeed enjoy across the globe. Therefore, although this is a complex slide, what it really shows is the lack of disease-specific and state-provided social benefits to our patients with hemoglobin disorders. And what this equally complex slide shows is that according to what we have just shown and to many other parameters that are described in the Global Review 2021, the conclusion is that there is a huge inequity amongst the quality and the extent of services received by patients across the globe. There are huge inequalities, and these are prominent within and across countries, within and across regions of the world. And there are many and complex unmet needs, both in the area of prevention and clinical management, in the cornerstones of clinical management, basic management, blood transfusion, iron chelation, multidisciplinary care in more than 80% of our countries, of the countries studied in this report. And Thalassaemia International Federation went further to develop a model, a generic model for estimating the cost of illness, a disease-specific model with the help of health economists and health care providers, patients. And indeed, this generic model was developed by TIF and offered free of charge to competent authorities and healthcare professionals to support the development of disease-specific policies, to recognize the importance of estimating, the importance of applying quality care to these patients in improving, of course, their quality of life and social inclusion, but also in reducing the costs and allowing competent authorities to extend their services to these and other patients. So this is a tool that is very important for policy planning, recognition of the disease, and integration of prevention policies and innovative drugs, therapies into the model. Needless to say, representing a patient organization to underscore the value of the patient engagement, and they assume even more and more active and meaningful role at the decision-making level, both at the country level, at the regional level, and at the international level. We have seen patients' advocacy and the success of patient advocacy in a number of policies developed at the international level through TIF's work, But also we have evidence, policies being developed and reformed and revisited at the national country level through the voice and advocacy of the patients themselves and their families. They can be involved in the designing of the educational material, in the planning of the transfusion services, in research and clinical trials, as this small diagram on the right shows, right from the conception of the new drug through the clinical trials, post-authorization collection of data. The value of the patient engagement is certainly beyond any discussion or doubt. And here we are just assessing the level of contribution of patient associations across the world. And all this slide shows, although a complicated slide again, it shows that patient organizations need strengthening in their infrastructure, but more importantly, need strengthening in their education and advocacy competency so that they can advocate with evidence and with good collaboration with their healthcare professionals and competent authorities. So, ending my presentation and thanking the organizing committee, I would like to stress the fact that Egypt has been a country very close to the heart and work of Thalassaemia International Federation, with a carrier rate ranging from 5.3 to 9% as per the published literature. Sadly, with no national registry and nationally coordinated prevention program. Hopefully many attempts have been made in the past, and I'm sure it's on the national competent authorities agenda, and we hope that this can be achieved in the next few years. Very active work by the Egyptian Thalassemia Association, the patients, the families, and our close collaborator and friend, Professor Bushlau, and many other names, which allow me not to mention here, have been working very hard for the quality of care these patients are receiving. However, there are many gaps, as in most of the countries around the world. We need to improve in Egypt as well as in other countries the voluntary non-remunerated blood donation practices, to establish a more structured and well-coordinated, centrally coordinated system with hemovigilance programs that patients and healthcare professionals are aware of. Adequacy is very important, as the pre-transfusion hemoglobin in published data at least show that there is a gap there and a need for improvements. There is no cost of illness study in Egypt, and therefore our TIFs model can support the competent authorities to actually develop one. And we need, of course, a national registry, standards for MRI to assess the iron load and improve the effectiveness of iron chelation strategies, and very importantly, to integrate innovative therapies into their new policies, as well as, although centers of expertise are available in Egypt, and we're very well aware of some, including the Cairo University, yet these need to spread across the large country of Egypt and develop a structured networking. So we need to act. We need to act now. The rights of the individuals, patients are being violated across the world, and there is ample scientific evidence of how to effectively prevent, treat, and cure these diseases. So there are no excuses that policies cannot be developed, because developing policy, then you can also address cost effectiveness of the healthcare, and in particular the public health system. And now we are at the very important point of huge dramatic scientific and medical developments, innovative therapies that we will need to include, that we will need to make them available and accessible to our patients. Thank you very much, and I wish you a good success in your very promising and educational event.